There is a QR code on your screen if you want to check out the Advocacy Day website during this and after, and get started early and start registering now, hopefully. Thank you again for being here. I am Simi Bookall. I'm the Director of Communications and Programs at Resolve, the National Infertility Association. I'm, thrilled to kick off tonight's conversation. The webinar is We Are hashtag All in Fertility, the Power of Personal Stories and Advocacy. Let me stop sharing. So this webinar is hosted by Resolve and a few of our incredible volunteer advocates in the lead up to our virtual Federal Advocacy Day happening May 20th in partnership with the American Society for Reproductive Medicine. So you may have seen the hashtag all infertility circling around if you're on social media, and it's more than a catchy hashtag. It's a call to action, because when it comes to expanding and protecting access to care for infertility and family building, we need everyone, all voices, all stories from every corner of the country. When we show up together, united and strategic, our message is loud and is clear and impossible to ignore. The Advocacy Day gives us that chance. It's a day to speak directly with lawmakers and staff about the urgent need to support family building and reproductive health policies. And while we're not all policy experts, and we don't need to be, personal stories are one of the most powerful tools that we have. They put a face to the issue, they make it real, and open hearts and minds on Capitol Hill virtually. So I want to thank our dedicated volunteers on our Advocacy Day Planning Committee, especially the Community Ambassador Subcommittee for organizing tonight's webinar. A special shout out to Stacy and Christina, including tonight's host, Joe Cody, who you'll hear from shortly. Now, I'll turn it over to Joe, and he's a passionate patient advocate, also the CEO and founder of Grain Fertility, an IVF dad, health policy expert, and someone deeply committed to improving fertility care and access across the U.S. Please welcome Joe Cody.
Hi, thanks, Simi. It's so great to be here this evening. I really appreciate the opportunity to, one, get to talk to so many dedicated volunteers. It really is the lifeblood of organizations like Resolve to have people from the community going to Capitol Hill to tell their stories and to really make an impact. I think this is one of those things where we have the opportunity to take back some semblance of control during a process that is so overwhelming, and you feel so often like you're a passenger in your own journey. And so Resolve has afforded me and others the opportunity to channel that energy into doing good and hopefully being able to make this process easier and cheaper and more effective for those that come after us. So tonight I'm really excited to get to talk to a couple of our dedicated volunteers who are going to be telling their stories, and more importantly, what Advocacy Day has done for them, or if you're first time advocates like one of our speakers tonight, what they're hoping to get out of Advocacy Day and why they joined and why it's so important for our community to be engaged and involved with it. Advocacy Day for me is incredibly special because it was really my form of therapy as my wife and I were going through nearly 4 years of IVF. The therapist that my wife and I were seeing during our infertility journey suggested that I start to get involved with Resolve as a way to channel this energy. And I really have found a community of very dedicated, passionate people who have gone through similar experiences. They understand what it's like, but more importantly, are trying to work to enact change. So I'm very excited to lead this discussion. And we're going to kick things off with Melissa Feldman, who's going to be joining us. And I'll wait for her to do her mic. So, hi, Melissa. It's great to talk to you.
Hi, thank you for having me tonight.
Of course. So I want to get started first by allowing you to introduce yourself. So tell us where you're from, who you're going to be advocating with, and how many advocacy days you've attended, and then tell us a little bit about your connection to the infertility community.
Yes, absolutely. So, hello everyone. My name is Melissa Feldman. I'm from New Jersey. I've been an advocate with Resolve for the past 6 years now. First as an advocate on Federal Advocacy Day, and then I've slowly gotten more involved over the years. Last year, I served as New Jersey's state captain, which basically just oversees the delegation and helps all the advocates get prepared for the day to meet with members of Congress and their staffers. And this year, I'm leading the state captain committee for the US, and we're overseeing all of the states, making sure our captains and their delegations are prepared for May 20th. Um, my personal story in connection to infertility, over a 6 year time period, I underwent a dozen fertility treatments, including IUI and IVF. I faced several pregnancy losses and had surgery for stage 2 endometriosis. Eventually, I received a diagnosis of catastrophic ovarian failure, and I eventually resolved my story and became a mom through donor egg IVF. So, despite some insurance coverage, the financial burden still exceeded well over $100,000. So since then, I really committed myself, similar to Joe's story, putting that energy and that, passion for, what we went through and just trying to make it better for the next person, feel less alone, have better access, hopefully get insurance coverage for these life-saving, family-building treatments.
It's so powerful to hear someone who's gone through so much, taking that energy and really trying to channel it and turn it into something good. Because there's so many opportunities for us as patients when there's so much failure and there's so much downside to it
Yeah.
to retreat into it. So it really is inspiring to have someone like yourself take that and try and turn it. So, you kind of talked a little bit about your own personal journey and the challenges that you had, but what really inspired you to speak up and to become involved with Advocacy Day? What was there a single event, or was it more of a I just have to do something?
Yeah, I think it was really just having this overwhelming sense of like I need to try to make this better. I think, after going through so many rounds of IVF and then needing to turn to donor eggs, which, I did with enthusiasm because it was a chance to build my family. Of course not without, a lot of thinking and all of that. And, there's always doubt that comes in. But just being, I think, shocked at how little coverage is available and support and awareness. And you're kind of just navigating so much all by yourself, or you feel like you are by yourself, and you really need a community and to know that there's other people that have gone through something similar to you, that you're not alone. And I think that makes it feel like, okay, I can do this. And I think, I turned to Resolve, to a support group, to just social media, and found like, wow, there are other people like me who are going through similar things, and I can do this. And I think, having a strong sense of community is really important. And I've definitely gotten that with advocating for Resolve.
It's completely true, and there's so many things that people get out of this beyond, it really is for me was definitely a source of healing and telling your
Yeah.
story and how much empowerment there is in owning everything that you and your spouse or partners or
Mhm.
yourself are going through in this process.
Yeah.
So I know this is your 6 year, I believe you said.
Yes.
So
Yeah.
there's been some changes in Advocacy Day over the last 6 years. So for those that
Hmm.
don't know, before the pandemic, Advocacy Day was in person in Washington, D.C. I don't know whether or not you attended an in-person one or if you were purely virtual, but
I was a virtual. Yeah. Yeah. I've been
okay.
virtual.
So tell us a little bit about the first Advocacy Day. What did you expect going in? What, did you learn from it, and what
Mhm.
surprised you, and then what empowered you as you did that first day and talking with lawmakers and meeting others?
Yeah, so I had personally never done anything like this before. So I didn't really know exactly what to expect. I'd never spoken to a congressional office. I wasn't even sure too much about like what would this day look like. I knew I was going to be talking to members of Congress or their staffers. But what did that all look like? And I think the lead up to Advocacy Day, I think Resolve and all of the volunteers and the staff at Resolve do a really excellent job at making it so easy and accessible to advocate. You know, we do a lot, there's a lot of focus on preparation. And so going into that day, I felt like I had all of the tools and that I needed to be a successful advocate and really just focus on how do I want to tell my story? Because I think, you know, that Resolve, you know, we reinforce this a lot with, you know, our advocates. Your story is so impactful and so important, and that's exactly what the staffers or the members of Congress need to hear, because you're putting a real story with a face, you know, when you're talking to them. You know, I think Resolve does an excellent job of preparing us with talking points and everything related to legislation, and the issues at hand. But I think what surprised me the most was like, wow, I can do this. Like, I felt totally prepared. You're with other advocates from your state, so you feel supported. Again, like that sense of community. You're not alone talking to the members of Congress. So I think it feels like I took some of that control back. I did something really positive, and you know, my voice made a difference in my state and my congressional district, and it just feels really rewarding every year to take part of that. I think the energy is palpable when you're with your group advocating.
I think it's so important. One of the things that you said there is how you're not alone through this process. And one
Hmm.
thing that we always ensure is that no person goes into a meeting by themselves. You will
Hmm.
always have another advocate by your side, especially
Yeah.
an experienced advocate. I've been in meetings with people from Nebraska, Oklahoma. I'm going to be the state captain of DC this year, which I did live in Washington, DC at one point. I live in Maryland now, but I'll be attending other meetings as well as as one of the senior advocates, I think, for Resolve now at this point. But know that there's always someone there, and I'll put my contact information into the chat for anyone. If you have any questions whatsoever, your state captains are going to do a great job preparing you. But if there's anything else you have any doubts, reach out to me. I am more than happy to talk to you, walk through that process because I know what
Yeah.
that's like that first time.
And there's one thing I wanted to add too. I think one thing I remember really surprising me was, you know, in each of us talking about our experiences on Advocacy Day with it was a staffer. I remember she opened up and talked about her own experiences with infertility, and she felt comfortable enough to share with us. So we ended up really just talking, you know, back and forth about the issues, and I think just that, you know, a person from that, you know, representative's office felt comfortable enough to share that she had struggled with miscarriage and was currently seeking treatment. I thought that was really impactful too. So, you know, I think it just underscores you don't know what other people are going through. And I think, you know, having the courage to share your story, you know, is helping someone else. And in that case, the person we were talking to for Advocacy Day.
Absolutely. I've been in a meeting before with a Republican member of Congress and staffers, and the one of their staffers told the member of Congress right there in the meeting that they had a child via IVF, and you could see the kind of shock in the member's face. And then they immediately changed the conversation to, okay, how can I help? There was that personal connection
Yeah.
that was established. And I think it's really important if we go about this because, and in your own words, why do you think it's so important that we have a wide range of voices to be help shaping the family building policy? Because lawmakers may not necessarily understand what patients go through. So, kind of talk about that a little bit more.
Yeah, so you know, I think, and one thing that I've learned in sharing my story, and I've been very open about my story on social media, like within my own network, and then obviously, you know, as part of Resolve. You know, no two family building stories are the same. I think we all each have, you know, uniqueness to our stories, and there's a lot of different factors and complexities to infertility care, and it's not one size fits all. And I think it's really important that you know, we use our voice to educate members of Congress on all the different ways that you can build a family. I mean, 6, 7 years ago, I had no idea what egg donation was. And here I am years later, you know, and that's how I built my family. And I think, you know, folks who don't go through it personally or don't know someone who has or has spoken, you know, who have spoken to someone about infertility and different treatments, they just don't know. So I think it's incredibly important that we, you know, all come together because we've all gone through different things. We have a lot of similarities and crossovers, um, but sharing our different stories, our unique stories, is incredibly, incredibly important because there's so much complexity, to the issues, and we want to make sure that that's reflected in the legislation, and so that we can make meaningful advancements in family building policies in the US.
That's so well said, and I appreciate everything that
Mm.
you are doing and others are doing to help spread that word and telling those stories, because storytelling is the most powerful tool that we have as advocates to be able to enact change that we know is important. And so, in your own words, kind of end on this. So why
Mhm.
should someone sign up for Advocacy Day? How would you sell Advocacy Day to someone who hasn't participated in this before?
So I would say, Advocacy Day is your opportunity to, I'm going to go back to something you said, Joe, take back control, right? We lose so much control going through infertility, and we lose, our control over the time frame of when things happen, or if they can happen at all. And there's so many challenges that we go through. It's an opportunity for you to take one day. You have the attention of, a member of Congress or a representative. Share your story, be part of this movement, of this organization that's working so hard to break the stigma or the taboo that's associated with infertility. And there shouldn't be. There's so many of us going through this. So many people in your life that may not raise their hand and I encourage you to. I know it could be uncomfortable, but be that person who shares their story, be proud of it, embrace it. I think we do a great job. We take care of everything, getting you prepared for Advocacy Day. We just need you to come, on that day, May 20th this year, with your personal story and ready to talk to members of Congress. You have their attention. And I think it's just such an important day. It's one day of the year, and you get to meet. I've made now like lifelong friends who have gone through similar experiences in infertility, and it opens up so many opportunities for you, and it's such a great organization, a great day to take part in.
Well, Melissa, I really
Mm.
appreciate you taking a few minutes out of your evening to tell your story, to talk about Advocacy Day and why it's so important to you, and more importantly, why others should join us as advocates and allies
Mm.
on Advocacy Day in May 20th. And Simi's put in the chat how people can sign up and register. If you have not registered, you can go to Resolve's website and spread on social media. The getting the word out to your friends and family is incredibly
Yeah.
powerful to help spread this because it is so important. So thank you very much for telling your story.
Mm.
And now we're gonna switch a little bit actually from a seasoned veteran like Melissa to actually someone who's going to their first advocacy day ever in Shar Rochelle. So Shar, how are you this evening?
I am good, Joe. I'm actually like really honored to be here to be able to be on this platform. So I'm good, but I'm a little bit anxious.
Before we were on camera, you were saying how this is one of the first times you're really starting to tell your story and you're embracing this. And it takes so much strength for you to do that. So I just applaud and commend you for that courage, knowing everything that you've gone through to take this step and how powerful it is and hopefully the impact it can have for others. And so would love for you to tell us a little bit more about yourself, where you're from. This is your first advocacy today, so we don't have to talk about that, but also tell a little bit about your journey and how you actually found out about Resolve and Advocacy Day.
Okay, absolutely. So, as he mentioned, I'm Shar, and I am from the great state of Texas. My journey, a long story short, because we'll be here all night. So in 2019, I had a TFMR. I basically found out that my baby had a neural tube defect, which I didn't really know anything about that. I found out maybe 2 days before the termination cutoff period in Texas. So the doctors were telling me like, hey, this is doesn't look good. We think you need to terminate for medical reasons. And I followed through with that. So I was about like 24.5 on the week. So I was pretty, I was there. And so we had to make that very tough, heartbreaking decision to do something like that. It was literally the hardest, most painful thing that I've ever gone through in my life. Like I lost my brother, which was close to me, but this right here took the cake. Like I don't think I could ever experience any hurt more than that. And then moving forward after that, we struggled so much to get pregnant. Like it just was not happening. And in my mind, I'm like, they did something happened, like it's their fault. So I'm like in that mode, I'm just blaming everyone because I'm upset, I'm in my feelings. So went on and we like for the life of me, like nothing would happen for like a year. And then we were able to conceive again, but it was a chemical pregnancy. Um, and then after that, same thing. Couldn't get pregnant, go to the doctor, like everything is perfectly fine. It's okay, just wait. And I'm like, no, I don't know, something's going on. I don't know what's going on. So I did all the testings and everything like that. Maybe 6 months later, I ended up getting pregnant again, but it was an ectopic pregnancy. So here I am again having to make another termination. Um, Not by choice again. So get through that. And I add, if you've ever been through ectopic, it's the worst because you have to continue to go to the doctor to make sure you're not pregnant, watch your HCG levels drop while you're in the waiting room with all of these other pregnant moms. And I just feel like something has to be done about that as well. Like the waiting room area, like it should be like a separate area or maybe stagnated like appointments or something. But that's a whole nother topic. Um, so that happened. And so then once again, I'm like, okay, we try again. Year to date, I get pregnant again, and I have another ectopic. So once again, I'm sitting here and I'm just like distraught. So during all of this time, I'm going through this completely alone. I don't have a community. I basically alienated myself because I was ashamed, embarrassed, and everyone in my family, they hadn't experienced anything like this. And I literally was alone. I did try to find a support group, but they judged me based upon my decision for the TFMR. So they made me feel like an outcast. So I'm literally alone by myself all of this time, like literally feeling like I'm in this cave, just stuck by myself, right? So time passes and I decide that, okay, I can't just sit here and feel sorry for myself. I have to do something. I can't just let my life literally waste away. So I decided to start working from home. So I started working from home, just doing like a customer service job. And little did I know, I found out that that employer actually offered fertility coverage. So I'm like, okay, and I didn't even know that was a thing. I'm like, okay, this might actually be God working this thing out for me. So I went and, we found out the cost of IVF for my husband. We were like, okay, I mean, if that's what we have to do, sheesh, that's what we'll have to do. I mean, it's pretty pricey here, but so that ended up, we called and they told us the price and they were telling us these numbers and we're like, oh, okay. All right. So, then she was like, okay, but after this, you have fertility coverage and you're only gonna have to pay like $1,500. It was something like, I was like, whoa, okay. I was like, it's a sign. So, long story short, I am a IVF mama. And that's basically my long story short story. And then how I got, to be honest with you, Joe, I don't even know how I got connected with Resolve. Like, I have no earthly idea how it happened. Like, I know I followed Resolve, but I don't know like how the connection happened. So one day I'm going through my email and it's like, hey, we will like be a part of Advocacy Day. And I'm like, what is this? And literally when I got that email in my mind, I was thinking, okay, I have to do something. Like I have to get connected. I have to find a community because I don't want other women to feel how I felt those past 5 years. I was like, this is not okay for anyone to feel like this. I know how I felt. I'm like, I have to get plugged in that community. I have to make a difference. Where it is, how I do it, I don't know. And so literally I got an email from Resolve and I'm like, thank you, God. Like that was pretty good. And so literally I got connected with Resolve and Advocacy Day. I'm a part of the letters and retention committee. And so basically what we're doing is we're crafting a letter to be sent out so that way you can send those to the like senators and the House and all of that good stuff. So that's my team. We're working on that. And I'm actually really excited to be a part of that because I had no idea. how I would get connected into this space in this community. And I'm like, okay, so they're on a political level. That's actually pretty cool because now I have the option or I have the chance to be able to speak to, on a political level to help make sure that we can get coverage for women that don't have it because it's so many women that they're like, I want to try this, but I don't have my job doesn't offer it or I don't have the funds. I'm like, I have to figure out a way. Like I have to figure out how do they get grants? How do they do this? Like I just have to be a part of this community to make a difference and I can no longer be silent. So this is my very first time even sharing that part of my story. And like I said, I have more in between that, but I'm getting a little emotional because I'm like, oh my goodness, I really said it. I'm telling people because for so long I just sat there and ashamed and embarrassed that I was broken. I was less than.
Yeah, it's so powerful to hear you tell that. And again, for you to take this step and to talk about something so personal and painful is such a inspiring thing to me and to others. So just know how much it does mean to us for you to be telling your story. But I think more importantly, how important it is for people like you to be telling your story to educate lawmakers and policymakers about the realities of recurring pregnancy loss, of having to have terminations that are due to medical necessity, having ectopic pregnancies. Lawmakers, unfortunately, don't really have a very good understanding, and
Yeah.
we can try to lecture them all we want. However, powerful storytelling, talking about you being in a waiting room with pregnant women and having to deal with that, put such a personal touch on this. That is how we drive change, and this is how we really will help, make bipartisan progress in
Right.
expanding access to care and ensuring that individuals, women, couples, partners, and everyone in the community has access to the care that they deserve, not that they should hopefully have
Yeah.
access to through their employer. So
Absolutely.
you kind of said, you didn't really remember how you found out about Resolve. An email popped up and stuff. But what made you actually want to take that jump to volunteer and to go? And you talked about being on this letter committee and how, you feel like this is a great way to jump into the political space and to tell your story and to help with others. But what was that process like? Is inspiring to jump in? Because a lot of people will sign up for Advocacy Day for the first time, kind of tip their toe in the water. You're going headfirst right in and just powerfully telling your story. So tell me a little bit about that process.
So if I'm being completely honest with you, I like literally God told me like this is something you have to do. Like this is your purpose. Like you went through all of these things because this is there's pain, there's purpose behind your pain. So I knew when I saw that from Resolve and then I looked into Resolve to see everything, I'm like I have to do this. Like I have to share my story because I'm not the only person and I have to speak for someone that is not yet ready to speak because I was that person at a point in time. Like, and I'm so thankful for everyone, like Melissa and Joe and everyone else that I have met in Resolve that have paved the way for that were speaking for someone like me that couldn't say anything. But now it's like, okay, enough is enough. I've stayed quiet too long. It's time to make a difference. It's time to make a change. Like I have to do something and I have to make it count. Like I have to make my story count. Um, there has to be change. Like no matter what, like we deserve change. Every family deserves to be able to have the opportunity to be able to have some type of opportunity to even try.
It's so true. And something that you said there kind of reminded me of, early in my family's journey where we were not public. So I'm just now, been advocating for a long time, utilizing my background in policy and really trying to enact this change. But for the first almost 2 years of our IVF journey, my wife and I were not telling people. Our very close family members, the only people who knew. And then once I started to get involved with Resolve and we started to tell our story a little bit more, the number of people who reached out to us, family members, friends, coworkers, who also told us, "Oh, we're going through IVF now." One of my best friends reached out to me afterwards, and after my first advocacy day when I posted about it, and he said, "Yeah, my wife and I are getting ready to start IVF," and having that, and then you realize how you feel so alone and isolated but in reality, you're not. And there are so many people who are doing this silently who don't know about the community that is there and the impact it can have. So, by us telling our stories and putting ourselves out there, hopefully it tells those other people who are doing this in silence and alone that it is okay to engage with this community and to know that you are not alone. There are people here to help you. And that's, I think, the most powerful thing that Resolve
Yeah.
can offer for everyone. It provides you with that voice.
Yeah, absolutely. I totally agree because I didn't have that when I was going through it, like I stated, alone. And Joe, just to be completely honest with you, my family that they still don't know to this day. I don't know if I started watching on here, but they still don't know to this day. So I'm still getting there. Like you just inspired me. So I'm still getting there to continue sharing my story and getting it out there because who knows who I might inspire or who may be going through something similar, like, oh, I didn't even know. So yeah.
Well, to know that it's you actually who are inspiring people like me to continue to come back because although my family's journey is resolved, I still think it's so important for us to continue to be involved. And I know how much, people who were involved in the community when I first joined helped me and provided me with that strength. And so trying to provide that to others is so important. And I know this next generation of IVF advocates like yourself is going to be that exact same stone for
Yeah.
that foundation for people as we do enact change. So I kind of want to close with the same way I talked to Melissa's. So this is your first time, but why should someone sign up for Advocacy Day? Why should someone start to tell their story, even if they feel like they may not necessarily be quite there and ready to talk about it? Why do you think someone should be doing this?
I think it's very important to share your story because you don't know the impact of what your story can do and the change that it can make. So, for example, I was afraid to share my story for so long, but if I would have spoken up 4 or 5 years ago, we might have seen change in the TFMR community. We might have seen change in the IVF community. So, don't ever think your story is too small or it's not that it won't make a difference. Like you can definitely make a difference. Like one voice counts. So I highly encourage you, please, please sign up for Advocacy Day. So you can make an impact. So you can make an impact. So you can make change in this community. So we need to see change, y'all. Like we need to see change like immediately.
Well, I really appreciate you going out and telling your story, adding a voice to a community that often is voiceless. And you are an incredibly inspirational person for all of us. So thank you for all the work that you are doing. It does mean a lot to us and to others. And, if you want to join Shar and others on Advocacy Day, please register for Advocacy Day. Tell your story. It's important. Like she said, every single person can be that, that powerful voice that can lead to change. So I appreciate you joining us tonight. And then
Thank you,
finally,
Joe.
of course, so I want to bring on our final guest tonight. So Carrie King has joined us also. So wait for her to come on. Hi, Carrie. How are you doing?
I'm good. How are you, Joe?
Doing great. Thanks so much for joining us tonight. I really appreciate it. And so wanted to let you introduce yourself to the community, talk a little bit about where you're from, your connection to the fertility community and how many advocacy days that you've participated in.
Okay, so I'm Carrie King. I am from Mississippi. I am part of the LGBTQ community. My wife and I have undergone several rounds of IUI uh, treatment with a clinic here in Mississippi, and we have yet to be successful. And I have done, I think this is my third year for Advocacy Day. And my first one, I was so scared because I was the lone soul from Mississippi to attend, and I didn't know what to expect. And I kind of chickened out. And then I was like, I got to do this. You know, this is something I need to do because nobody here has ever heard of IVF or, infertility clinics like that. And once we went through our first round, it was impeccable of the responses that we got of friends and family being like, hey, we want to try this, or hey, I'd done this for 19 years and finally succeeded.
Wow, that's fantastic. And being someone from a historically underrepresented state is so important for us to ensure that we have representation in Congress where you can go tell your story to lawmakers from Mississippi, like you said, who may not necessarily have a good understanding about one, the prevalence that infertility has in the community, whether it is in communities like yours, which is required in order for you to be able to have the family that you and your wife so desperately want, or straight couples like me and my wife who had to have medical necessity in order for us to be able to have children of our own and going through this process. So it really is very important to be able to have that type of representation there. So I thank you so much for being an advocate and talking about your story. So, what inspired you to take that step to speak up and to get involved in Advocacy Day? I think your own story is incredibly powerful, and I think you are able to talk about different experiences than someone like myself who doesn't know necessarily what it is like to go through that process. So tell me a little bit about, what inspired you to want to lend your voice and be the sole person from Mississippi for the first year that you were there.
That was my sole reason, was because I was the only person from Mississippi, and being, of course, a lesbian couple from such a small, town in Mississippi, I was always the voice for the little people that didn't have a voice. So why not be a voice for someone, in Mississippi that I know has faced something the same way we have.
So tell me a little bit about what that first Advocacy Day was like. Obviously, going in, you talked about how you almost chickened out, how it was a very scary experience. You clearly didn't, and you're still with us. And this is, I believe you said, your third year. So tell me a little bit about kind of what you thought it was going to be like, and then what was it actually like, and what was the thing that said, okay, I'm going to continue to come back and lend my voice.
The fact that I actually started seeing slow responses, of things changing, it was really overwhelming at first because I didn't know what to expect going in. I was just like, okay, I'm gonna make a difference. I'm gonna do this, and I that set my mind to it, and I did. And now being here for my third year, I've gotten a lot more confidence now than I did, and I've met so many amazing people that have helped me.
That's fantastic. I think the confidence that people gain through this process is incredibly real. I hear it all the time from people who have continued to come back to Advocacy Day, or even people who have only done one and their schedules may not allow them to do it, but they still are involved in other ways. And I think Simi can provide some more details later on, or you can go to Resolve's website to figure out other ways to be involved as an advocate, whether it's, advocating for your employer for coverage, writing letters to your members of Congress if you can't attend Advocacy Day at the state level, et cetera, talking with people. So one of the things that I think is so powerful when we've seen just the diverse representation on this panel alone shows how infertility does not discriminate based on sexuality, gender, race, location, socioeconomic status, all of that. So why do you think it's so important that these wide ranges of voices, be heard as, we're talking with legislators about family building policy?
Because everyone needs the opportunity to build their family no matter what. I mean, it doesn't matter who you love, what skin color you are, no matter what, you deserve to at least have a chance to build your family.
That's so true. And I think one of the great things about Resolve is, trying to provide resources and support to everyone who's going through this, regardless of where you're located, what you look like, et cetera. And so finally, I wanted to, in your own words, why should someone sign up for Advocacy Day? Why should someone who may be on the fence or say, I don't know if I really want to do this, it's a big leap to do that. Why should people get involved in Advocacy Day and lending their voices?
Because it may not seem like you're making a difference, but in the end, you really are, because you're taking the step to be a voice for someone that's just not ready yet.
That's fantastic. Well, Carrie, you are an inspiration to all of us, and thank you so much for your work that you are doing with the volunteer committee and for your community, for your state, and everything else, and being that voice for others who may not necessarily be there yet and able to lend their story. Because I think when they see people like you telling your stories, it does give them that confidence to take that step forward and to lend their voice. So people like you have done such a great job for this community, and I really commend you and appreciate everything that you and others are doing. So thank you so much for joining us tonight. I really appreciate it.
Thank you, Cody.
Of course. Well, Simi, I think this has been a great discussion with a lot of people who have had different experiences and really trying to show what Advocacy Day is like. And we've seen how people come in, they may be hesitant, they may be scared, they may not necessarily know what to expect when you're something as intimidating as meeting with a lawmaker or staffers. But you've heard every one of these advocates have said how empowered they feel afterwards, how inspiring it is when they see others lending their voice, and hopefully all this will, help provide that little boost of confidence to others to sign up for Advocacy Day. So I appreciate everything that Resolve does, and I want to turn the floor back over to you to plug one final time how people can sign up or any other things that you want to ensure that is promoted.
Thank you so much, Joe. As always, that was fantastic. You're a natural. Thank you so much for moderating that discussion. And thank you to all of our panelists for sharing your powerful stories and insights and for being so open with us all tonight. And before we wrap up, please feel free to drop any last questions in the Q&A chat box. But while I give folks a moment to do that, I'll just go over a few final reminders and details. Advocacy Day is May 20th. Registration closes on May 9th. So if you're thinking about joining us, don't wait. Once you sign up, you'll receive an email asking you to confirm your registration with our team, and that's required for you to move forward with your registration. Everyone who registers is invited to pre-event meetings and meetups, including opportunities to connect with your fellow advocates from your state. So register as soon as possible so that you can join these live meetings and ask any questions before the event. And again, Joe was saying earlier, you will not be alone. We'll pair you with an experienced advocate or a state captain to help you prepare and lead the way during your meetings. Again, this is a virtual event. You can join from anywhere. And best of all, it's free to register and participate. Everything is free. There's no catch to it. So our goal is to have every congressional district represented at Advocacy Day. If you don't know what your congressional district is, just head to resolve.org/advocacy day. I popped that in the chat earlier. You can enter your zip code. And once you go to the homepage, you'll scroll down. There'll be a map that shows the districts we have represented and the listings underneath to tell you which districts we still need to be represented at the event. And there's a link in there that you can click and it'll take you to a website where you can add your zip code and find out exactly what district you're in. And one quick ask before we go, we still need an advocate from Wyoming. All states except Wyoming are currently registered or have at least one person registered. But even if your state is covered, we need more advocates in every district to be represented at Advocacy Day. So just because a state is registered doesn't mean that your district is covered. Let's see if we have any questions. I had one here. What are the specific policy issues we are pushing access and coverage? Can I reach out offline to learn more? Of course. And it seems Connecticut is not represented so far. I believe we have representation in Connecticut, but we might not have representation in your district. So you'll want to check on our website for that. As far as specific policy, we don't have the specific policies yet. But one thing to keep in mind, as we get closer to Advocacy Day, we will announce what those policies are. But again, what we were saying earlier, that you're spreading your awareness through your story is one of the most important things you can do when attending Advocacy Day. We most definitely will have either like specific issues or topics of issues that we will want you to discuss with legislators, or again, if you're not comfortable, there'll be someone who would fulfill that part of the meeting to discuss legislation or to give them, a paper with more information to follow up with Resolve, for example, if they have more questions. But that will be discussed closer to the event. And again, your story is the most important thing to focus on. But if you have any specific questions, you can email us at info@resolve.org Advocacy Day, and I can put you in touch with our Advocacy Day manager so that they can email back with you and give you some more specific questions or answers if they have any for you at the time. And it looks like that was our only question. So we'll wrap up for the evening. Thank you again, and email us at info@resolve.org with your Advocacy Day questions, and we look forward to seeing you at the event. Have a great evening, everyone.